Hello and welcome to this BNEWS special report. I'm your host, Rich Hosford. Today I'm joined by State Senator Cindy Friedman. We're going to go over sort of the upcoming legislative agenda, things that she's hoping to accomplish, the different issues facing the state and the local district. So let's get started. And Senator Friedman, welcome to BNEWS.
Hi, Rich. Nice to see you.
You as well. I hope everything is going well and everybody in your circle is safe and healthy during all this.
We are safe and healthy, and I hope in yours as well, and everybody in the district.
Yes, thank you very much. We are as well. So just want to kind of start off broadly. What are some of the sort of, the big issues that you see kind of either in the works or coming down the pipeline, sort of like big picture?
There's a number of conference committees that are going on right now, so I think that's the big focus. There's, our healthcare bill, which has telehealth and scope of practice and surprise billing. That's in conference committee, so I'm the lead conferencee for the Senate while we negotiate with the House to come up with a compromise bill. There's a climate change bill that's in conference committee. The police reform bill is in conference committee. I'm missing one. I'm forgetting one, but there's a transportation. So I think there's those are the big issues, and then along with that, of course, is the budget.
Right.
So we're working through all of those as the different conference committee. Oh, and economic development, that's it, not transportation. So those are the focus right now. And then I'm sure will be some cleanup, hopefully, for the end of the session, which ends on January 2nd this year. And so we've got a lot on our plate, especially for the last quarter of the session.
Right.
Excuse me.
And, obviously we're in the midst of the pandemic and everybody's sort of worried about healthcare. And you mentioned that right at the top. So let's just kind of drill down a little bit more on that. What are some of like the top priorities of the healthcare bill? What are you hoping to kind of, get out of that or focus on?
I think the big issue right now is just to keep telehealth going. As you know, we expanded access to telehealth when the pandemic began, and it's been a huge success. And so what our legislation does is it would extend telehealth beyond the pandemic and ensure that that people have access to it and providers can use it to serve people. So that's a really big one. Another big one is that we've expanded the practice for certain nurses and certain healthcare providers during the pandemic so that people would have access to providers. And we did that under the emergency order. And now we want to extend that so those people still can provide services. We call it to the top of their license. So they can be doing everything they are allowed to do under a license. And that's really important because that also extends access. So we'll be looking at that. We have a number of issues around substance use and mental health. We're seeing that rise to the surface as an issue. That's been exacerbated by the pandemic, and that's something that I certainly want to dive deeper into and make sure that we're doing everything we can to address the needs of people who mental illness or have a substance use disorder. And then there are the pieces that we've been working very hard on, which is parity for mental health, ensuring access and costs for drugs that people need. We'll be working with Mass Health to make sure that they continue to provide increased rates to Medicaid hospitals and providers so that people, again, can get access. And these are all areas where while we knew they existed before the pandemic, they've been exacerbated by the pandemic. And we want to make sure that we continue to do everything we can to support our hospitals, our community centers, and providers in treating people across the spectrum of needs.
Now, obviously, one of the big things in the news right now is, at the federal level, challenges to the Affordable Care Act. I know Massachusetts was sort of a special situation, but are these sort of bills sort of helping to shore up what we have locally here in the state if, the federal, act were to be changed or dissolved?
Well, there would be some effect for Massachusetts, but I think we're pretty well, in most cases, I think we are well protected from that because our laws and much of our statute existed before the Affordable Care Act. That doesn't mean to say that we won't be affected and that people won't be affected. We certainly have a lot of people that are under insurance policies that are with companies that are self-insured. And so if you work for a company and they self-insure, we don't have any control over what your benefits are. That's just by law. We can't, they're called ERISA plans and we can't control them. That would be a huge problem for a lot of people. So yes, we're worried in a lot of in areas, but in other ways, we're well protected. We do need to worry about what the federal government's going to do with Medicaid and Medicare. Are they can continue to fund them? Are they going to create block grants for states, which would be a real problem? So there's a lot up in the air in the federal level, and it's very, very important and critical what happens over the next couple of months.
Right. Now, you had mentioned people with substance use disorder. I know you're, part of the joint committee that deals with that. Just talk about the effect. We've been doing some reporting here with the Burlington Police Department, just about, when everything fell off and everything closed. That included, AA meetings. It included, meetings for people with, opioid addiction, and that sort of change or the break of that sort of routine had a big impact on people. What would you like to see, the state do more to, assist and help people through recovery?
It's a really tough problem. So much of what has exacerbated issues for people who have substance use disorder or mental health conditions is the isolation that the pandemic has brought on. So while we understand why AA meetings had to be canceled or, why group therapy was put on hold, we had to do that. The state didn't have much choice, but we really need to focus on how we get connected with people when they can't actually be together. And that is something, certainly telehealth has been essential in, in maintaining those connections. It's been invaluable, but we have a lot more to do and we need to be spending a lot more time focusing on how outreach is going for people. Don't assume that if we don't hear from people, they're okay, that we, and in a lot of cases, cities and towns and organizations know who those people are. So we need to continue that reaching out. But also, we've had a lot of beds closed, a lot of facilities, a lot of closed beds because people stopped coming, they couldn't take people, then they had to social distance. So we have to make sure that we're supporting those facilities, institutions that help people and that serve people who have a substance use disorder or a mental health condition who need that kind of inpatient treatment. And we're focusing on that right now to understand, what we need to do to ensure that those services are still in place.
Yeah, I think a lot of people are feeling sort of cast out on their own in this situation.
Yes, and we should be worried about it. And it's not just, now it's a lot of children and a lot of, adolescents who have lost that connection with their peers and with adults, other adults besides their families. It's having a profound effect.
Switching gears a bit, something else that you actually brought up in the overview. So this year, at least, towns, including here in Burlington, are having to make budget cuts because of, a lack of local receipts. But fortunately, state funding was kind of level funded this year, or state aid was level funded. But what, moving forward, as far as, getting the state back running and supporting local towns, what are you seeing, first of all, is, the potential impact on local municipalities and schools, and what do you think, might be, something that can be done to assist them?
The state is committed to level funding local aid, UGA, and Chapter 70, and with some inflation included in the Chapter 70. And the state and the legislature has made that commitment, and we're standing by it. We have no reason to, you know, to see that changing for FY21. And I recently sent a letter out to my cities and towns saying that to reiterate that commitment, and to let them know if we see anything on the horizon that's changing, and we don't, and we will do everything we can to meet that commitment. And I don't foresee anything changing, and I did not foresee a pandemic. So,
Join the club.
we're doing the best we can, but all things, we stand by that commitment. Let's be clear. We cannot, as a state, work our way out of this financial situation that we're in. We are not losing revenue because we are being inefficient. We're not losing revenue because we're wasting money. Our revenues are down because people have lost their jobs, and because businesses have closed, and we have been spending money shoring up those institutions that we need the most, like hospitals and schools and food security programs, and emergency funding for people who've lost their jobs. So we have done I would say, a very good job in working our way through this pandemic, but we cannot do it alone. And the federal government must be a partner in that. And it's jaw-dropping to me that there's discussions at the federal level in Congress about whether or not states and cities and localities, municipalities, should be getting support from the federal government. And that's what they're discussing. And that is what one of the big roadblocks is to getting a relief package. And it's just, we are not alone. Every state and every city and town across the country is suffering from this, right? We're all in a financial situation. And again, it's not it's a recession, guys. This is a pandemic. And we really need our elected federal representatives across the country to come through and support states and localities when they need it the most.
Yeah, I mean, I think that the inaction at the federal level is something everybody can agree has been a pretty big frustration.
Yeah. Yeah.
Is there specific things that you would like to see them do? Is it just put more money into it? Is there certain programs that should be, focused on? Or is it like, what's the mechanism that you would like to sort of, see happen?
I think that the states need funding just to keep their operations going. Mm-hmm. If we started to cut right now, we would be cutting the programs that people need the most. Okay, the food security programs, the transitional aid programs, housing subsidy programs, healthcare, Medicaid and maybe Medicare would be affected. We don't pay for Medicare. That's, federal, but all of those uh, funding, all of that funding, we are now, it's more and more the burden is on the state. And so we really need that local aid, that aid that would come directly to the states to continue their programs, especially programs that served as safety nets, because so many people need those safety net programs right now. So I would like to see that. And I would also like to see them continue with help with unemployment. This is especially going to be a problem for our businesses because they're paying unemployment now, and so much of their unemployment insurance is going to rise significantly.
Right. Even as their revenues are down.
Yeah, and their revenues are down, and they need help. And it's not because people we're playing fast and loose with money. It's that we are in the middle of a pandemic, and we've had to, for public health, we've had to shut down our economy, and that's why we have a federal government, is to help. In my mind, is to help states and localities and to level the playing field when we need them the most. So I would like to see them just step up and pay attention to states and local governments. And they need to also continue to support, their Medicaid and hospitals and first responder support, because we're still in the pandemic. We still need all these people.
Right. And, with the reduction in what people are getting from unemployment, I know one of the big fears that people have is sort of like a mass eviction of, renters or people losing their homes due to the mortgage. Where are we as far as protections for that? And what do you think that, there should be more as far as, helping people be secure and the fact that they won't lose their homes?
I am of the opinion that if the government does nothing else, we should make sure that people have housing, have food, have health care. But those are and I would add education to that, but the very fundamentals of our society rest on, do you have a roof over your head? Can you put food on your table for you or for you and your family? And do you have health care when you need it? Okay. And so when I think about that and I think about housing, I do think that we need to be very focused on ensuring that people don't lose their housing. Now, having said that, I know the governor's just come out with with more money for aid to families that RAFT, which is transitional aid, home-based program, which provides funding for housing and paying rent. We've increased our caps on what we give people. And I think that's all really good, and I'm glad he did it. We need to go further, though. So not only do we need to address the issue of people who have lost their jobs and can't pay their rent, but we also need to address the issues of landlords, small landlords, who rent those apartments, who now can't pay their mortgage.
Right.
And so that's really a package. So I think in the beginning, what we did was, it was such a massive problem that we just said, okay, everything's on hold for now. Now we're getting, the moratorium is ending on the 17th. And we need to look at what we have to do to ensure or shore up those two groups. We can't forget that people have just been, their mortgages and their rents haven't been forgiven. They've just been put on hold. So all of these costs are multiplying. So if you haven't paid your rent for 4 months and you have a $2,000 a month rent, you now owe $8,000. Well, if you haven't been working and you work a job where you make $20 an hour, where are you going to get $8,000 to pay that back, right?
Right.
And where is that small landlord going to get the money that he needs or she needs to pay the mortgage? So we've got to look at all of this as a package. And I know that the Senate, and I think the House is too, are very much involved in a housing package, and coming up with something that would hopefully address that over the longer term. I think what the governor did is good, but it's just not enough money.
Right. Okay. And do you see a similar situation with, small businesses trying to pay their rent as well? Most often they don't own the building that they're located in. Do you see like a similar need for assistance in that area?
Sure. The payment protection program that was put in place, I think, by the feds was a good thing.
Yeah,
And I
the
think
second round.
that's the kind of thing that the federal government should continue to do, because you're right, they can't pay their mortgages. Do we really want all of those empty storefronts? Do we want, the ripple effect of this is just enormous. So yeah, maybe you don't own a small business or you still have your job, but do not think for a minute that you are not affected by what's happening to the economy around you. And I read a really good piece that talked about, there was a worry that if people got $600 a month, they $600 a week in addition, and we did that for a while.
Right. They would choose not to work.
And we're going to choose not to work. Well, that didn't happen. People were still looking for jobs. People want, 98% of the people, and I'm sure you can find somebody who's, gaming the system, but a huge majority of people want a job. They want a living wage job that they can count on. So all the indications were that no, people want to work. People want to get back to work. People aren't enjoying this.
Right. No, I think people enjoy the stability of, having a paycheck rather than, money from the government.
Absolutely.
So where do you see where we are now? I mean, we're sort of we're in phase 3 of the reopening. I don't remember what step exactly we're on. It's 2, I think, maybe 3 in some places. I know it's different. Boston is, behind because of
Keeping up with it, and I see it every day. But
so, what do you think are the next steps to kind of getting us back to normal? Are we going back to normal? I mean, I keep seeing reports that we're having at least a slight rise in cases. Where do you think we kind of go from here?
well, I think we have to continue to be very cautious. There's a lot of worry about the cold weather coming, people being indoors more. It is very useful that we could have our families sitting out in our backyard, right?
Or eating outside.
That's going away. And so there's real concern about the spread of the virus, upticking. And we're seeing a little bit of it. And I've actually talked a lot with the command center about where the uptick is. And it's really across the board. It's not any one cohort of people that are getting infected. It's really pretty evenly across. So I think we have to continue to be very cautious, and that is again why we will need support over the next several months until we get a vaccine.
Yeah, and about the vaccine, I know it's very early. There's no vaccine yet, and this committee has just been launched. But you are part of the state's vaccine advisory committee. Just talk about, I guess, why that position interests you, what you kind of hope that comes out of that committee. What the goals are.
Sure, I was asked to be on it, and I'm very honored to be on it. It is quite a cross section of people who understand this world much better than I do. But I think the purpose of this group is to ensure that there are very robust plans in place, and the mechanisms and the all of the tools that are needed are in place to roll out a vaccine efficiently, and as quickly as possible once that vaccine comes. It is an enormous, enormous job to roll out a vaccine. And the last one, the big one they did, I think, was the H1N1 virus, where we all, I remember going to the high school and getting a shot, a vaccine. So it's enormous, and it takes a huge, a very coordinated, if you think of a big machine with lots of cogs and they all have to connect, that's what rolling out a vaccine is. And this one is especially tricky because we're looking at possibly vaccines that need to be kept in very unique storage.
Yeah, very cold, right?
Yeah, ultra cold, minus 70 degrees centigrade. Well, there aren't too many minus 70 degree centigrade freezers out there, certainly not at our local CVS or our local, public health. So the purpose of this is to help ensure that there is a very, as I said, very robust plan in place about how we deliver it, what the phases of delivery are, who needs to get it first, how do we ensure it's equitable across the state. That's the goal of the is to advise that work.
Yeah, it's definitely not just a vaccine is developed and then you just go to the doctor and get it. I mean, there's so much behind the scenes that you don't really think about.
Right, it's amazing. And when you think about all the vaccines that we do have now that are just there and available, but I don't know, I'm of the age where I remember going to get the polio vaccine in my elementary school on a Saturday and Sunday, and the whole community was there getting a little sugar cube with
Right.
the polio vaccine, and it was an enormous event. So, and I didn't know what it took to do that, to roll that out.
And real quick, while we're on the subject, I think this is a good time to remind people that according to the CDC, it's more important than normal to get a flu vaccine this year because we don't want to have, more unnecessary people or people unnecessarily in hospitals. So
Yes.
go do that.
Absolutely. I got mine. Did you get yours?
I got it on Saturday, local CVS. We've only got about a minute or so left. I just wanted to really quickly just kind of switch gears kind of completely. Just sort of talk about the bill to reform police standards. What is it trying to accomplish, and why do you think it's an important thing to have?
Well, I think we've seen across the country that there have been some very, very shocking and very disturbing issues around justice. And we have even now seen more and more in our state. And I think besides that, it's always important to look at our institutions and say, with an eye of what can we do better, and how can we ensure that there is justice for all, meaning the police can do their job with the tools that they need and people can feel safe on the streets, and that we that people aren't discriminated against because of what they look like or where they live. And I just think that that's critically important. And I think my constituents, so certainly for the most part, are demanding it. And I don't think it hurts. And I think if you're running a really good police department, which I can say pretty much with certainty that my district is full of,
Yep.
then I don't think you have anything to worry about. I think you would want to be part of any solution that would enhance people's trust. And so I think that's what I think that's what this bill is trying to do. It's in conference. The House and the Senate are trying to reconcile their differences. And I just think it's something's going to happen. We're going to see a bill. I'm almost 100% confident that we will see something. And I, uh, I think it's something that is very important.
All right, very good. Well, we've hit the half-hour mark, and I think we've covered a lot. I'm sure there's some other things we could have gotten to, but I really appreciate you taking some time and talking with us today and keeping the people of Burlington informed about what you're up to on their behalf in the State House.
Well, I'm always happy to do it, and I thank you so much for having me on and giving me the opportunity.
Oh. Well, until next time, I hope you stay safe and healthy as always.
Yes, you too, Rich. Take care.
You too. Thank you.